been an exhausting 9 months for frontline healthcare workers mentally and physically. So this week, Lori Borghi, a nurse anesthetist at SF General, couldn't wait to get vaccinated to protect herself, her family, and others. She got her shot yesterday, and she joins me now. Lori, so nice of you to join us.
Hi, Janelle.
How are you feeling? Any side effects from the vaccination yesterday morning?
I can't even tell which arm they put it on. No side effects at all, and it didn't hurt.
They say it's like similar to a flu shot. Would you say that is the case?
Yeah, to me it was easier. So, but yeah, I can see the similarities because a certain number of people do get fever. It's a low percentage, only about 3%, but about 70 to 80% get soreness in their arm at the injection site.
I love the video. You're like rolling up your sleeve, ready to rock. So tell us about your job.
I could not wait.
Yeah, I know. Tell us about your job as a nurse anesthetist. You are on the front lines treating COVID patients firsthand.
Yes, as a nurse anesthetist, I intubate patients in the operating room and do their anesthetics, but I'm also called to the emergency room, the ICU, and labor and delivery to intubate people, and oftentimes it's for COVID. So we're called all over the hospital for COVID patients.
So you've seen COVID patients firsthand. You treat them. Right now there's a surge going on, the highest we have seen since the pandemic started. And a lot of them are young folks. They account for about 35% of cases now, people ages 18 to 34. So you know this firsthand. It's a myth that they don't get that sick. You've seen them get really sick.
I have seen them get really sick. I've seen people die, but also something that I don't think people are realizing is that you can get sick and have very long-term consequences. I see people getting the breathing tube taken out, but a trach put in instead, a feeding tube put in, and then they're in a long-term care facility until they die. And I think that's the hardest to watch, are these young, vibrant people with children of their own, and everyone's fighting for them, and they're just not doing great.
And Laura, you said some people do survive, but also have like lung damage or like have trouble breathing for weeks or months possibly afterwards?
Yeah, we call them long haulers, and they get short of breath, turning over in bed or walking down the hall, lots of fatigue and muscle soreness, and it's a post-viral syndrome, and we don't know how long it will last.
The last 9 months, very emotional for you. You're a mother of 4. What has it been like for you? Have you been worried about getting your family sick? Have you ever had to isolate from your family?
I've been prepared to isolate from my family. Luckily, I've had enough personal protective equipment to feel pretty comfortable coming home, showering, and then being with my family. I have not had a significant direct contact with a COVID patient, an exposure, I should say. But one of my sons has a heart condition, and I'm very worried about him. I do everything I can to try to protect my family from getting COVID.
Before we let you go, just quickly, you've taken the vaccine. Moderna now out with its vaccine. What would you say to people who are hesitant about getting it?
What I would recommend is to read the science if you can. The science explains how there's no live virus in this vaccine. They're just putting the spike protein from the virus so that your body and your immune cells will recognize the vaccine, or I mean the COVID virus, if you were to be exposed to it, and it can attack it before it attacks you.
Okay.
And so I would encourage everyone to get a vaccine, because we need a light at the end of this tunnel, and the vaccine is the way to do it.
Yeah, Lori Borghi, you've been in this dark tunnel for a very long time. We appreciate you so much. Lori from SF General, take care of your family and happy holidays. Thank you so much.
Thank you, you too.